Welcome to the last session, Session 20, of the series Overcoming Social Anxiety, Step by Step. Throughout this series, we have been emphasizing the need for you to personalize your therapy. That is, for you to spend the time, each and every day, going over the handouts that are the most necessary for you. Even in the past few months, everything that we have covered has not had enough time to sink down into your brain and become automatic yet. Thankfully, by this time, it is typical that many methods we have talked about are already cemented into your brain because of your practice and persistence. But with the ones that are not, you still need to stick with it and be persistent even when you're tired or bored. Continue on with the cognitive therapy until social anxiety becomes just two emotionless words from your past. We started this series out with the importance of practice and persistence, and we need to end the series with an admonition on these very same points. It is still very important that you continue on with the handouts and concepts that are not cemented into your brain. The only way your brain learns, believes, and feels new things is by continual repetition. Since there are no shortcuts, we need to continue on until these cognitive methods and strategies are fully operating automatically in our lives. The cognitive therapy that is on this tape series is comprehensive in nature for generalized social anxiety. But you may have a trouble spot or two that is peripheral to the main symptoms of social anxiety and that was not explicitly covered in this series. Typically, there are some of these symptoms of social anxiety that do not need to be addressed directly. For example, every time we do something in the real world to deliberately bring attention to ourselves, we are working against our self-consciousness and center of attention inhibitions. So as you get better in one area of social anxiety, you get better in other areas as well. With the cognitive therapy that hasn't made it to the point of being automatic yet, please do not give up under any circumstances. Whatever you have already dropped down into your mind is still there. Continue to add to it through your 30-minute-a-day practice sessions. You might be asking, when can I stop this 30 minutes a day practice session? The answer, of course, is when the methods and strategies are no longer simply methods and strategies, when they are automatically occurring in your life. For example, when you have used slow talk in practical, real-life situations enough, you begin to automatically use it whenever you need to. At this point, you will not need to remind yourself to use slow talk anymore, because without thinking about it, you will already be using it. If the practicing is becoming boring, or a particular handout is still hard for you to believe, the answer is to vary what you are doing. Do some reading in slow talk, some listening to the tapes, and some deliberate relaxation and exercise without use of the tapes. Practice some things in your car. Leave messages to yourself on the refrigerator and on your nightstand. Leave therapeutic reminders in your desk drawer at work. And use any free time during the day to go over a handout, even if you're not at home. And, of course, do this every day. Again, hit more strongly at the areas in which you need to see some more improvement. If you continue forward with your cognitive therapy, it will become stronger and more automatic for you, just like some of the other methods have already done. Keep in mind that the most difficult areas of your life, The most difficult anxiety situations are always the last areas to be resolved. One limitation of this tape series that you read about before ordering is that I could not personalize the cognitive therapy just for you, which I would do if we were in a regular therapy session. But I am trusting by this time that you have a good idea how to do this for yourself, and you also understand the importance of doing this. A bigger limitation is that some of you may not have a behavioral therapy group to attend at present, where you actively work on reducing anxiety through your anxiety hierarchy that was discussed on tapes 14, 15, and 16. We have set up a special page on the Social Anxiety Institute website that will keep you current with comprehensive CBT behavioral therapy groups around the world. We are expecting these groups to be composed of other people with social anxiety, and hopefully one or two of you who have listened to these tapes and have made progress against social anxiety in your life can lead them. It would be wonderful if in the next year or so more therapists could learn and put comprehensive CBT for social anxiety into practice. However, since we are living in the real world, the chances of this happening are fairly remote. So some of you may feel like you can lead or co-lead a therapy group, particularly in areas where there is no appropriate help available. As I write this, the lack of appropriate treatment exists in almost every location in the world. So another way of saying this is, in order for you to continue your progress into a behavioral therapy group, you may have to take the initiative and do it yourself. It will help to have a co-leader, and it will help if the other people have a cognitive foundation for working on the behavioral activities. But I would not encourage you to wait around until therapists are conducting appropriate comprehensive groups for social anxiety, as this could take an entire lifetime. So this is another area, a big area, in which some of you may need to become proactive and take the initiative if you can. I have given some very general information about behavioral therapy groups on this series and tried to explain how they should be conducted. These guidelines and examples were on tapes 14, 15, and 16. It is our intention to make a separate audio tape series concerning only the behavioral therapy group for social anxiety, which will be more detailed and more specific. It will be a shorter series that people who sponsor a social anxiety behavioral group can use to help them. They will also be addressed to anyone with social anxiety, however, since understanding and knowing how these groups work is of great benefit to everyone's progress. As you have moved forward and developed some positive momentum, it is good to sometimes look back and see what progress you have made, and then give yourself some credit for it. Just by being persistent and dropping the cognitive information into your brain, you deserve to recognize how very positive this is. It is good to pat yourself on the back when you make progress. Many people choose to sit on their couch and do nothing. You have chosen to get better and to be in control of your life. This is a major decision, and you need to be aware of its positive repercussions and how it is changing your life. And it is always important to keep the momentum going. Don't let other people block or stop your progress in any way. I know that to some people this means drastic life changes, but overcoming social anxiety is generally more important than anything else. Most people I have worked with would move anywhere or do anything to get better. This attitude, of course, helps them to keep moving on, keep the momentum going, and ensures their recovery from social anxiety. After having lived with social anxiety myself for so long, I know that it takes bravery and courage to make these hard decisions and to do things that